You wake up, and before you even open your eyes, before the light hits your face, before you remember what day it is, your body has already sent you a message. Your mouth is telling you something, not in a vague, easy-to-ignore kind of way, in a way that is immediate, uncomfortable, and impossible to dismiss. Your lips are stuck together. Your tongue feels thick and heavy. The inside of your cheeks feel like they are pressed against dry paper. You swallow, and there is almost nothing there. Just that hollow, scratchy pull in the back of your throat that makes you wince before you are even fully conscious. And your first instinct, before you check your phone, before you think about breakfast, is to find water. Immediately. Like you have been somewhere without it for a very long time. Now, here is what I want you to sit with for a moment. You probably had water last night. You probably drank something before bed, maybe even made a point of it. And yet, here you are, waking up parched in a way that does not quite make sense. So what do most people do? They drink a glass of water, go about their morning, and tell themselves it is just because they slept with their mouth open, or because the room was warm. They file it away under things that happen and do not mean anything, and they never think about it again until the next morning when the exact same thing happens. I want to be direct with you today. And I mean this in the most caring way I can. If you are over 50 and waking up with a dry mouth regularly, your body is not doing this randomly. It is not a quirk. It is not just aging. It is communication. Your body is one of the most sophisticated systems that has ever existed, and it does not send persistent signals without a reason. My name is Dr. Edward Wright. I have been practicing internal medicine for nearly 25 years, and in that time I have had thousands of conversations with patients who came to me with something serious. Something that had been quietly developing for months, sometimes years. And when we traced it back to the very beginning, it was almost always something small. Something they had dismissed. Something they had been waking up with every single morning and simply decided not to think too hard about. The patients who caught things early, the ones whose stories had good outcomes, were the ones who paid attention. So today, I am going to walk you through exactly what is happening in your body when you wake up with a dry mouth, why it matters far more than most people realize, and what you can begin doing about it. Stay with me through this entire video, because what I share toward the end is the part that most doctors simply do not take enough time to explain. Let us start with what is actually supposed to be happening in your mouth while you sleep, because this is the foundation for everything else. Your salivary glands do not shut off at night. They slow their production. That is normal and expected. But they are supposed to continue producing saliva at a reduced but steady rate throughout the night. And that matters enormously, because saliva is not simply water sitting in your mouth. It is a biologically active fluid. It contains enzymes that begin digestion, proteins that actively fight harmful bacteria, and it maintains the pH balance of your oral environment so that your gums, your tongue, and the inner lining of your cheeks remain healthy and protected, including while you sleep. When that production drops below a certain threshold, the bacterial environment shifts, tissues dry out, and become vulnerable. The protective coating disappears, and by the time your alarm goes off, everything you feel on your tongue, in your throat, against your lips, that is the result of what has been happening for hours while you were unconscious. But here is the thing that most people completely miss. The dryness itself is not the problem. I want you to really hear that. The dryness is a symptom. It is downstream of something else. And depending on what is actually driving it, we could be talking about anything from an easily correctable lifestyle factor to an underlying medical condition that, left unaddressed, carries serious long-term consequences, particularly for people in your age group. The body at 50, 60, 70 has less physiological reserve than it did 30 years ago. That is not a criticism. It is just biology. It means the margin for error is smaller, and honestly, your dry mouth may be your body being more direct with you than it has ever been. This is not the moment to look away. The first thing I always look at, the very first question I ask when a patient tells me they wake up every morning feeling like their mouth is full of chalk, is how they are breathing during sleep. Not how they think they are breathing, how they are actually breathing. Because for a significant number of people over 50, that answer explains everything. When you breathe through your mouth during sleep, the physics are straightforward. Air moves continuously over the soft tissues of your mouth and pulls moisture with it as it goes. Every breath, in and out, for 6 or 7 or 8 hours, is slowly evaporating the saliva your glands are trying to produce. By morning, those tissues are not just dry. They are depleted in a way that a single glass of water does not fully reverse. Now, mouth breathing itself is not complicated. What matters is why it is happening. For some people, it is structural. A deviated septum from an old injury or chronic nasal congestion from allergies that has been present so long they have stopped noticing it during the day. These are real causes, and they are addressable. But there is another reason for nighttime mouth breathing that I want to spend more time on, because it is one of the most underdiagnosed conditions in adults over 50, and its consequences go far beyond a dry mouth. Obstructive sleep apnea. If you have never had a sleep study done, I want you to hold that name in your mind while I explain what it actually involves, because there is a good chance what I'm about to describe will sound familiar. Not because you have read about it, because you may have been living with it. As you move into deeper stages of sleep, the muscles throughout your body relax, including the muscles in your throat and the soft tissues at the back of your airway. In people with this condition, those tissues relax to the point where they collapse inward and partially or completely block the passage of air. Your body, sensing the oxygen drop, does what it is designed to do. It jolts the system just enough to reopen the airway. You might gasp, shift position, or produce a loud snore that your partner has mentioned more than once. Then you drift back down and the cycle begins again. This can happen 5 times an hour. It can happen 30 times an hour. And the vast majority of people who have it have absolutely no conscious awareness that any of it is occurring. What they are aware of is the morning, the dry mouth before they are even fully awake, the headache sitting behind the eyes, that particular kind of tiredness that is different from simply not getting enough hours, a tiredness that sleep does not fix, that coffee only partially masks, that has been building so slowly they have started to accept it as just how they feel now, just what getting older feels like. And honestly, that resignation is one of the most medically costly mistakes I see. Because here is what is happening inside the body during those episodes. Every time the airway closes and oxygen drops, the cardiovascular system is put under acute stress. Heart rate changes, blood pressure spikes, the body releases a surge of cortisol and adrenaline as part of the emergency response. And for someone with moderate to severe untreated sleep apnea, this is not happening once a night. It is happening dozens of times every single hour. Every night, year after year. The cumulative strain that places on your heart and blood vessels is not theoretical. It is documented and measurable. We are talking about significantly elevated risk of hypertension, cardiac arrhythmia, stroke, and heart attack. And in the over 50 population, where cardiovascular resilience is already naturally reduced, that is not something to brush off. I want to share a story about one of my patients, a woman in her early 60s, retired, active, and by every outward measure in reasonable health. She came to see me about some knee stiffness, routine visit, but as we talked, I asked about her sleep, as I do with every patient, and she mentioned almost as an aside that she always woke up with a terrible dry mouth and had started keeping a large glass of water on her nightstand because she needed it the moment she opened her eyes. Her husband, she added with a small laugh, had moved to the guest room because of the snoring. I referred her for a sleep study. She resisted at first. She did not think it was connected to anything real. The results came back showing severe obstructive sleep apnea, with oxygen levels dropping into ranges that would have frightened her had she known. She began treatment. 3 months later, she sat down across from me and said something I have heard many versions of since, that she had forgotten what it felt like to actually wake up rested. She had been so accustomed to the exhaustion that she had redefined it as normal. Her dry mouth was gone. Her blood pressure had improved. Her energy had come back in a way she described as feeling like herself again, for the first time in years. That dry mouth, the thing she kept a glass of water next to the bed for, the small inconvenience she had never once thought to mention to a doctor, was the first visible sign of something that was quietly, nightly, placing her cardiovascular system under serious strain. Sleep apnea is the most common and often the most urgent cause I see, but it is far from the only one. The second cause I want to talk about is one that tends to make people uncomfortable when I bring it up, not because it is embarrassing, but because it carries a weight most people would rather not sit with. I understand that. But softening it would be doing you a disservice, so I will say it plainly and then give you the full picture. Because the full picture is genuinely more hopeful than the word itself tends to feel. Diabetes. Or more precisely, the state that precedes it, prediabetes, which is where the majority of people actually are when this connection first becomes visible. Here is what is happening in the body when blood sugar runs consistently higher than it should. Your kidneys are working under pressure. Glucose, when it accumulates beyond what your cells can absorb, has to be removed, so the body pushes it toward the kidneys for excretion. But glucose does not leave the body alone. It pulls water with it. This is why one of the classic signs of elevated blood sugar is frequent urination, particularly at night, getting up once, twice, 3 times before morning. Every one of those trips is fluid leaving your body, fluid that is not being replaced while you sleep, fluid your salivary glands needed to keep functioning. By the time your alarm goes off, you are in a state of mild but real dehydration, and your mouth is announcing it in the most direct way it knows how. What I want you to pay attention to is not just the dry mouth on its own, but the cluster around it. The dry mouth alongside nighttime bathroom trips. A thirst during the day that feels slightly out of proportion to how much you have been drinking. Fatigue that is heavier than it should be for someone who technically slept. Perhaps some blurring at the edges of your vision you have been attributing to your glasses prescription, or some tingling in your feet you have mentioned to no one because you assumed it was just circulation. These symptoms do not arrive all at once. They whisper. They come gradually, spread across weeks and months, which is exactly why they are so easy to rationalize one by one, even while they are collectively telling a very coherent story. Type 2. Diabetes has a long runway. There is often a period of years during which blood sugar is elevated and the body is under metabolic stress, during which the early signs are present and readable, long before any formal diagnosis is made. And that runway is not a curse. It is an opportunity. Caught in that window, with the right dietary changes, increased activity, and the right medical support, the trajectory can genuinely be changed. The complications that make diabetes so serious, kidney damage, nerve damage, vision loss, cardiovascular burden, these are not inevitable. They are the result of years of uncontrolled elevation. Get ahead of it early enough, and the story changes completely. So if you are waking up with a dry mouth, and you have not had your fasting blood glucose or your hemoglobin A1C checked recently, which gives us a 3-month picture of where your blood sugar has been sitting, please make that appointment, especially if you are over 50, if your weight has shifted in recent years, if a parent or sibling has diabetes, or if any of those other symptoms I just described feel even a little familiar. This is not about catastrophizing. It is about taking an early signal seriously while it is still early. The third cause is one I suspect many of you will recognize immediately, and yet it is almost never connected to the dry mouth in people's minds. Medication. Specifically, the medications that a large number of people in their 50s, 60s, and 70s take every single day, often for years, sometimes decades, without ever being told about this particular side effect or what it can mean over time. The list of medications that reduce saliva production is longer than most people expect. Antihistamines, which millions take for seasonal or year-round allergies, are among the most potent reducers of saliva production available without a prescription. And many people have been taking them for years without ever connecting them to the dry mouth they wake up with every morning. Antidepressants, particularly tricyclics, but also many SSRIs, are well-documented causes of reduced salivary flow. Blood pressure medications in the diuretic class work by encouraging the body to excrete more fluid, and that effect does not stop at the kidneys. It affects the body's overall fluid balance, including what is available for saliva production, muscle relaxants, bladder medications, certain pain medications, anti-anxiety drugs. The overlap between what is commonly prescribed to people over 50 and what is known to cause dry mouth is not a coincidence. It reflects the reality of how many conditions in this age group are managed with drugs that, as a side effect, interfere with one of the body's most important and underappreciated maintenance systems. What makes this particularly significant is what happens over time when saliva production is chronically suppressed. The environment inside your mouth changes gradually and invisibly. The bacterial ecosystem shifts. The organisms that cause decay and gum disease, the ones saliva normally keeps in check through its antibacterial proteins and pH buffering, begin to gain ground. In my own practice, I have seen patients who maintained excellent dental health well into their 50s, who were diligent about brushing and flossing and regular checkups, suddenly begin developing cavities in their 60s at a rate that alarmed and confused them. And in nearly every case, when we looked carefully at what had changed, the answer was a medication started somewhere in that window, a medication they needed, one that was doing its intended job well, but that was simultaneously creating an oral environment their teeth and gums could not sustain. And this matters well beyond the dental chair. Gum disease, which chronic dry mouth accelerates significantly, does not stay confined to the mouth. The research connecting periodontal disease to systemic health is substantial and continues to grow. There are documented associations between chronic gum disease and cardiovascular disease, cognitive decline, and difficulty managing blood sugar in people with diabetes. The mouth is not a separate system. It is connected to everything, and what happens in it over years sends ripple effects through the entire body. I am not telling you to stop your medications. I want to be absolutely clear about that. What I am telling you is that this is a conversation worth having with your doctor, a direct, specific one. I have been waking up with a dry mouth since starting this medication. I believe it may be a side effect, and I would like to know if there are alternatives or strategies to protect my oral health while I continue taking it. That conversation is worth having. Your doctor may have options you have simply never been offered, because you never flagged the symptom as significant. Now you know that it is, and we are not finished yet. There are 2 more causes I want to walk you through, and one of them in particular is something a surprising number of people in this age group are living with completely undiagnosed, attributing it to stress or aging or the general weight of life, never suspecting that their immune system is at the center of it. Stay with me.